Well, Uganda has been one of the countries ramping up efforts to contain and eradicate tuberculosis. The disease has become a heavy burden on the country's healthcare system, but as Isabel Nakiri reports, initiatives to wipe out the disease could take years.
Diagnosed with tuberculosis a year ago, Everest Ofula is now suffering complications. Despite being on free medication from the International Rescue Committee, Everest says he's getting weaker and weaker. Without enough food to eat, he says it's getting harder to take his medication, and this could spell even more problems.
I'm taking the drugs, and the food is not enough, and the drug is too powerful. So I become unconscious.
Everest is living at the Bidibidi refugee settlement in northern Uganda. He escaped violence in South Sudan after his family was killed. He gets his monthly rations of food from the WFP, but that doesn't last long. The Ugandan government gives every refugee a plot of land to grow food to reduce dependency on food rations, but Everest is too weak to cultivate his plot.
I have no power, and I can't be able to dig, and I'm a sick person. I have 8 lips and TB.
The WHO says close to 90,000 people in Uganda are diagnosed with TB every year, and about 1,000 of these suffer from drug-resistant TB. Drug-resistant TB occurs when bacteria becomes resistant to the drugs used to treat TB. This means that the drug can no longer kill the TB bacteria. Health workers warn patients to take their drugs regularly to prevent this. The disease is transmitted by breathing in air contaminated by the bacteria. Tuberculosis can be fatal if not treated properly. The WHO estimates more than 30 people die from TB-related complications every day, yet the disease can be prevented and cured. The Ministry of Health has started a door-to-door campaign to get more people on treatment.
The ministry is undertaking is to work with the partners in the districts and the district teams to plan and reach the households with a TB message. How is TB spread or transmitted? How does it present? Is there anyone in this household who has such symptoms, cough, fever, weight loss? Or is there a child who is failing to grow well or chest pain?
However, convincing sick people to get treatment is another matter. Some people are self-medicating without a proper diagnosis. Many reach hospital when it's too late. Others hope to avoid treatment altogether.
The hiding of symptoms and has caused delays in identifying people who have disease. Even when they come to the health facilities also, they want to, not to say that they have cough, they will say they have other things they have come for.
The country has set up specialized TB treatment centers around the country to contain the disease with the hope of ending TB by 2030. Isabel Nakiri, CGTN Kampala, Uganda.